My name is Dr. Kathleen Jude Estime, DNP, PMHNP nurse practitioner, and today we're going to learn about anaphylaxis. I hope you learned something. Let's start by defining anaphylaxis. You must understand that anaphylaxis is the severe, potentially life-threatening allergic reaction that can occur rapidly. You must be able to identify the causes and triggers, and you should be able to identify common allergens that can trigger anaphylaxis, including medications like antibiotic, foods like peanuts and shellfish, insect stings, and latex. Now let's talk about recognizing symptoms. Learn the key signs and symptoms of anaphylaxis, such as hives, swelling, especially in the face and throat, called angioedema, difficulty breathing, rapid or weak pulse, nausea, and fainting. Now let's discuss the pathophysiology. Having a working knowledge and being able to discuss the brief overview of the immune response involved in anaphylaxis, including the role of IgE antibodies and mast cells, is essential. Anaphylaxis is a severe allergic reaction, like we said before, primarily triggered by the binding of allergen-specific IgE antibodies to receptors on mast cells, causing them to rapidly release inflammatory mediators like histamines, leading to systemic symptoms like airway restriction, vasodilation, and low blood pressure. Essentially, the immune system overreacts to an allergen by activating mast cells through IgE cross-linking, resulting in a life-threatening cascade of the reactions. Some key points you need to understand about immune response and anaphylaxis are: 1, IgE antibodies. When a person is first exposed to an allergen, their immune system produces IgE antibodies specific to that allergen. These IgE antibodies then bind to high affinity IgE receptors on the surface of mast cells and basophils. It essentially sensitizes the cell. Number 2, mast cell activation. Upon subsequent exposure to the same allergen, the allergen binds to the IgE antibodies attached to the mast cell, causing them to cross-link and trigger a cascade of intercellular signaling, leading to the release of pre-stored mediators from the mast cell granules. Number 3, mediator released. The primary mediator released by activated mast cells include histamines, tryptase, and prostaglandins. Number 4, systemic effects. Histamines cause rapid vasodilation, increase vascular permeability, and smooth muscle contraction, and leading to symptoms like swelling, hives, low blood pressure, airway restriction, and rapid heart rate, which are characteristics of anaphylaxis. The important considerations. There are important considerations like non-IgE mediated anaphylaxis. While most anaphylaxis cases are caused by IgE mediated, there can be instances where other immune mechanisms or direct activation of mast cells without IgE involvement might contribute to anaphylactic reactions. Now let's discuss treatment with epinephrine. Due to the rapid and potentially life-threatening nature of anaphylaxis, immediate administration of epinephrine is crucial to counteract the effects of histamine and other mediators. Assessment skills. You must be prepared to assess a patient experiencing anaphylaxis, emphasizing the importance of a quick and systemic approach. Emergency response. Now let's outline the emergency treatment protocol, including: first, you call for help or activate emergency services. Then you administer epinephrine. You're going to want to position your patient, usually lying down with legs elevated if feasible. You're going to want to monitor vital signs and be prepared for CPR if needed. For post-management care, you have to understand the importance of monitoring after initial treatment, recognizing the reactions and the need for further medical evaluation is essential. Thank you for listening to our discussion on anaphylaxis. I hope you learned something. If you did learn something, please like, share, and subscribe.